We're back here at HealthGAINS. HealthGAINS is a 15,000 square foot facility that treats men and women of all ages to help them with a variety of age-related issues. And we're pleased to be joined by Dr. Alvaro Ocampo. We do. Dr. Ocampo is the medical director, and we want to talk specifically,
Thank
Doctor, about medical health, about sexual health for both men and for women. Mostly, we know about erectile dysfunction in men, and I've been talking about HealthGAINS on the radio for about 6 or 7 years now.
I know.
You do so much with that, but there's so many other issues, so many other treatments you could utilize to help men and women, correct?
Yes, one of the things that is very, very important in this area is to think from the point of view of preventive medicine. Why? Because as you said, and you have been talking about that, and the people that have been paying attention to you is the people that already need to resolve the problem.
Right.
And sometimes it's too late because it's the body is a machine.
Or they don't even think it's a problem. They're like, oh, it's age.
That's
You know,
the
it
other
just
thing.
comes with
Yes.
age.
Right.
And so they ignore it.
And so they don't pay attention to their well-being, they don't pay attention to their health status, to their nutrition, and by the time that they look into the problem is when they hear you and they say, oh, now there's a solution.
Right.
But you need to think in this, again, is in the whole range, to start with the prevention. How we can prevent this problem or how we can improve this cycle before we have the problem. And that's one of the things that we need really to emphasize and tell the people that.
See, I never thought of it in those terms.
Yeah.
What kind of things are you talking about? Exercise, nutrition?
Yes. First, to understand their health status. We know that as we age, things start changing. And like you said, a lot of times people just deal with the issue and say, oh, it's just the age, I'm aging and that's all. Now I cannot walk 2 blocks, so who cares?
And I may just have a vitamin D deficiency, or it could be the smallest things sometimes that takes your body out of whack, right?
Yes.
Yeah.
And again, sometimes they try to solve it in a very simple way. They ask a relative, oh, you have that pain in that knee, can you give me your medications? And they take medications from other people. The issue about sexual health, sex, even though that we are in a society that we think is very open with sex, we still are very mysterious with sex.
Yes.
Very few people, I remember years ago when the issue about the blue pill started, patients start to come and they never tell you, I have a problems with erection. The issue was, doctor, you know, I heard about this pill, this blue pill, and looks like it does something good things. You think you can prescribe me some? So I tell them, okay, I'll prescribe 2. He said, no, I don't want 2. I want 10. And he said, but you just want to try. And that's then when you start realizing that people, they deny what they have.
Right.
And everybody hides that problem. Today, even here, and people after they listen to you a lot of times, they kind of come very kind of mysterious and you start asking them, but what exactly is your problem? Well, they tell you about probably 25% of the problem. They never really tell you, you know, I have big problem with erection.
But see, that's what the great thing that you all do. You will draw those good questions and ask questions that they wouldn't ask themselves.
And every one of you, everybody who works here, including you, doctor, are very easy to talk to.
Right.
I mean, there's no taboo questions that can be asked here, correct?
That's the good thing. You come as a friend.
Right.
And they start opening.
Yeah.
So the person that first came like very kind of hiding, little by little, they open in a way that is amazing, and
Right.
that's how they become part of the family. This is kind of a family.
Yeah, it is. It really is. So you've got GAINSWave technology, which there's a lot of studies that have shown GAINSWave technology has been very helpful to men for ED. There's no shots involved with it. There are no drugs involved with it. It's a treatment that you can have a 20-minute here in the office and enjoy intimacy that very same night. Now, what about for women? What can you do for women with the problem?
For women, we can use a very similar approach. What we're doing is basically faking a damage to the cells. With GAINS wave, what we do is sound is applied to the tissues, and when the sound hits the cells are shaking, and they misunderstand that they think that they had been kind of attacked. So they send an alarm to the body and tell them, you need to fix me, I have been very traumatized. And the body starts to send things there, and that's how the tissues rejuvenate.
Right.
Now, with the females, we use a very similar approach, but with a different physical equipment, that is radio frequency. The radio frequency does the same thing. Instead of sound waves, this produces kind of heat, and the heat is transmitted and the tissue hits the cells, and again the cells kind of, they are,
Wake up.
they don't feel good because they think that they had been traumatized. So they ask for help, and again there is rejuvenation in the tissue.
Fascinating.
I know, isn't
It really is
so
fascinating.
interesting?
And so there are so many people who are so concerned and don't want to talk about it. And if you want to solve the issue, come here to HealthGAINS and have a conversation. The first thing they'll do is they will check out, they'll make sure you get an exam to make sure they're physically okay. Because there could be underlying problems that are a quick fix that might impact men and women, right? Like, for example, high blood pressure.
Yes. High blood pressure, you need to understand that a lot of times people don't pay attention to the so-called basic diseases or illnesses. Hypertension, you find a lot of people with hypertension. Diabetes, a lot of people with diabetes. You spend half an hour talking to a person about the sugar and this and that and how that kills you. 20 minutes later, you find them in the cafeteria and they are eating a lemon pie.
Right.
And you tell the person, say, but I just, told you about the danger of sugar and all that.
Right.
And they said, Doc, don't worry, I just put my insulin.
Right.
So that's the other bad part. The pharmaceutical industry, in a way, has produced this magical thought that when people take medications, now
They're
not,
just all well
Right.
again.
Exactly. You ask the people, say, do you have hypertension? And they tell you, no, I don't have hypertension because I take medication.
Right.
You have hypertension and you're taking medications for hypertension.
Right. Exactly right.
But then it comes the second part, that they don't take the medications a lot of times.
Yes.
So when they come here, you need to understand the other part of the medications. Many medications, and most of the medications, produce adverse side effects. Some of this medication for hypertension produce problems with erection
Right.
and
Oh,
sexual
really?
function.
Yes.
Interesting.
So we need to find out all the things, and sometimes in a short period of time, but little by little we open that, and then we can manage to see, even though that we are not the primary physicians, we can tell them and say, please talk with your primary and tell them that you're having this problem, because they had not told that to
Right.
the physician.
Right.
That change the medication. There are these other medications that they will help you with the hypertension, but they don't have this side effect.
I always send my blood work that you do here to my regular doctor.
Right.
Yeah.
Because they have to work in tandem to know everything that's going on. That's the first thing they'll do for you here at HealthGAINS. You'll get a physical, they'll take blood work, they'll know exactly what the issues are and help you to solve the problem. It's a new world out there, new technology, new research, and people like the folks here at HealthGAINS, Dr. Ocampo, they're just terrific, easy to talk to, as you can tell. So don't suffer anymore. Just don't do it. Doesn't make any sense. It's easy. Give the folks here at HealthGAINS a call. Doctor, what a pleasure to see you. Thank you so much.
Thank you to me.
Easy to talk
Thank
to.
you
What
so
an easy
much.
man. We'll be back with more right after this on HC East Florida's Eat This, Drink That, Go.